For Session Daily Updates, I'm Sarah Allen. A meeting of the House Health and Human Services Finance Committee is expected to get underway shortly. Representative Matt Dean chairs the committee. Let's take a look at what's expected to be addressed before we join members for the meeting.
All right, the Health and Human Services Finance Committee will come to order. We do have a quorum. The clerk will note the roll. Do I have a motion to approve the minutes for April 13th and April 14th?
So moved.
Representative Hamilton moves the minutes for the 13th and 14th. Any corrections? Seeing none, all those in favor of adoption of the minutes, please say aye.
Aye.
Those opposed, no. The minutes are adopted. First up, we have House File 3374. Representative Lohmer moves that House File 3374 as amended be taken from the table to bring the bill before us in the committee. All those in favor say aye.
Aye.
Those opposed, no. Motion prevails, and we have the bill before us. Representative Lohmer moves House File 3374 as amended be re-referred to the Committee on Ways and Means. Members, we adopted the A13 amendment on Tuesday evening in a roll call. A13 is in your packets. Since the bill missed deadline, the Chief Clerk's office has asked us to send it, and the Chief Clerk will intercept the bill and send it automatically to the Rules Committee. Evidently, that's the path it's supposed to take. We had a hearing on this bill on April 12th. This is a procedural motion. And we will vote on that motion. Is there any discussion? See no discussion. Representative Lohmer renews her motion 3374 as amended be re-referred to the Committee on Ways and Means. All those in favor, please say aye.
Aye.
Those opposed, no. No. Motion prevails. 3374 as amended is referred to Committee on Ways and Means. All right. Next up, members, we have the bill before us, which is House File 3467. I'm going to go ahead and move House File 3467 be referred to the Committee on Ways and Means. We have the bill before us. There are several amendments. We did walk through the bill with the staff the other evening. It's been online. We do have several amendments that we will be moving through, and just through the course of the day we'll be hearing the amendments and then be voting the bill out today, and any other discussion particularly to the amendments, and then we'll be moving the bill on. So we do have lots and lots of amendments. It's Friday morning at 10:45. It's going to be 74 degrees. Just going to make a suggestion that we go directly through, try to power through as quickly as we can, as opposed to stopping for lunch. If that's agreeable to everybody, that we do that. Otherwise, we do have the room until 11:59 tonight. Representative Liebling.
Thank you, Mr. Chair. First of all, happy birthday.
Thank you.
And I'm sure you would much prefer to spend your birthday outside in the lovely weather we're having now, and I don't think we all would. But one concern that I have is that we did receive last night a significant amendment on the bill, and if you recall, I asked about yesterday whether there would be an author's amendment that would be substantive, and the A27 is certainly a substantive amendment. I assume that's the author's amendment, although I don't know that for sure. Okay. And there certainly are policy issues in it that we've heard, but there's also a lot of spreadsheet changing, I assume. I mean, I tried to match up the amendment with the bill, and of course last night after when we had this and as we were going through these amendments, of course the staff was gone, which is not too surprising since it was quite late, but since the amendment deadline was 5:30 in the afternoon. And so we've had of course these things have been posted for less than 24 hours, of course, because here we are now at 10:30 in the morning, 10:45. And so I'm very concerned about this process, Mr. Chair, and here we're proposing to go through all these amendments today and try to vote the bill out. That was what you just said, and I'm really concerned about that because we had yesterday public testimony and a walkthrough of the bill, and of course people, generally speaking, can only testify to what's there in front of them. And a lot of what's here today in the author's amendment was not in front of them. Certainly the changes to the spreadsheet, which I still don't know what they will do, And everybody else drafted their amendments, I assume, to what was in the bill, not to the significant author's amendment that changed the spreadsheet. So, Mr. Chair, I think that this is a real problem for our process, because this committee process is supposed to be one where the public gets to know what we're doing here in the House of Representatives and gets a chance to weigh in and gets a chance to come to members and say, we like this, we don't like that, please do an amendment for me. And with this significant author's amendment, which I'm sure we'll hear more about, really people have not had the opportunity to do that. And certainly members of the minority have not had the opportunity to draft any amendments or really consider what amendments we might like to draft to the bill as it will be with the author's amendment on it. So I would ask the chair on behalf of the minority members to hold off on the markup and to not vote on this until Monday. And allow members of the public an opportunity again to weigh in, and allow members an opportunity to consider doing another round of amendments here in committee. Now, I know the bill will go to Ways and Means, but I think it's pretty clear that in Ways and Means, you just don't have the same opportunity to consider. Of course, we look at the money piece of it in Ways and Means, but there is significant policy change and significant fiscal change that's coming with this amendment. So that would be my request, Mr. Chair, that you would hold off on the markup, maybe do some of the amendments now, or do the amendments now, but hold off on final amendments and taking a vote on the bill to give the public and the members a chance to actually consider what's being done here.
Thank you, Representative Liebling, for that. I think if you look at the author's amendment A27, what you'll see is a group of bills that are bills that have, in fact, been through the process that we are moving forward. Also, some spending, first of all, that our bill has a zero net target to go into Ways and Means. We will go into Ways and Means with a zero net target. We also do have some, the author's amendment is a group of several amendments, and then there's amendments. I don't know exactly how many bills are in there, but then there's several other amendments outside of that we can discuss and vote on for both the majority and the minority, that some of which have not been heard in a committee process, which are new. So from that, there is spending. We reduce spending within the spreadsheet, and we reprioritize that within the A27, which nets us out at zero. And so anything else we adopt after the 27 will have to be zero net cost in order to move on to Ways and Means. So that's how I'd like to proceed. Representative Liebling.
Well, Mr. Chair, that's exactly the problem. So how are we supposed to have our amendments fit and give us a zero net target? Because we don't know how the spreadsheet's going to look after the author's amendment is on it. So I don't know. I mean, I assume that you're going to ask Mr. Berg to at least walk through. I haven't received any. I don't know if anything's been posted. I don't think so. A spreadsheet, an explanation of where the dollars are moving within this. And we all know it's zero net, but that doesn't help us decide whether we want to attempt to change the priorities within the bill. And so what you just said, while there's nothing, that I would quibble with you about what you said, it doesn't help us. It doesn't help the transparency of the process. It doesn't help the public. It doesn't help members be able to respond to their constituents who may like or not like some of the money that's being moved around in the bill. So again, I would ask you to hold off on the markup and do it on Monday and give people a chance to know what's happening within the bill.
Mr. Chair.
Representative Zerwas.
Well, I guess, Mr. Chair, not knowing what amendments would be offered at the 5:30 deadline, I know a lot of members put in amendments. I think there are 2 total DFL amendments. And for all of Representative Liebling's complaining about process, one of the amendments doesn't spend any money, and the other DFL amendment is included in your author's amendment. So the 2 priorities that you set forward prior to the deadline one is already in the chair's author's amendment, and the other doesn't have a budget target or doesn't have a spend, and so can be considered by this committee. So I don't understand. I don't understand what the problem is. I don't understand what the issue is. The Democrats offered 2 amendments. One is included in the chair's author's amendment, and the other amendment doesn't impact the zero target that we'll end up with. If you remember last year, Mr. Chair, the same complaints were raised, the same issues were raised, and the DFL at that time offered 0 amendments. So I don't see what the issue is. They have 2 amendments before us, and both of those amendments will be heard today.
And Representative Liebling, I think if trying to locate the money portion within the bill on lines 12.31, that's where the $2 million transfer is from the Consolidated Chemical Dependency Treatment Fund. That's the bulk of that, I think, that you'll probably see. And also, I think there's obviously in the minority. I've been in the minority, as have you, many times, back and forth. And this is an expression of our priorities, as are the amendments, both in committee and on the floor. And your opportunities is to say, within the target and within the bill, we think this is a bad idea, and if I had my way, I'd spend the money over here. And that's wholly appropriate for the bill within our target and on the floor, and I would expect that we'd have many amendments that would express your priorities that is totally appropriate as we move forward.
Well, Mr. Chair, thank you. I mean, we've been back and forth, and I don't think that, first of all, to Representative Zerwas, we can only respond to what we know is the bill. So, it may be that after we hear this amendment, the author's amendment, it goes on the bill, it may be that we don't have any problems or nothing else we want to do, but we don't know that, and the public doesn't know that until they see what the bill looks like. So that's the problem. So, it's great to include some priorities in there. That's thrilled. I'm thrilled that the program that I wanted to see funded is now in the bill. That's wonderful. And I think it's in there at the full request. That's terrific. But, first of all, it isn't about me and only my priorities. It's about all of the members, and more importantly, it's about the public. And how can people respond and react to a bill that they don't know what it's going to be? So obviously, members bring in amendments, and they offer them, and they either go on the bill or they don't. But when the bill author, when the chair of the committee, he put the bill together, and then he comes in along with the rest of us and makes significant changes to the bill, including to the spreadsheet. That's not the process that this should be. And so, you may be right. If we were to come back Monday, maybe there wouldn't be anything additional. I just don't know that yet. And I'm not, I don't speak for the whole public about what people may see. Maybe there are tweaks to language. This is supposed to be a process where we actually vet bills and make them better. If members are actually reading the language, trying to make sure that even the things we all agree on, we ought to be reading the language and making sure that it does what we think it does and so on. And we just can't do that with this process. So that's my problem. Additionally, I think members need to be careful what you argue, because we do flip back and forth in the majority here. And, I really do believe that we should have a process that allows the public to fully weigh in and all the members to fully weigh in. Sometimes the amendments are political. Sometimes they're serious policy amendments. Sometimes they're about priorities. Sometimes they're about wanting something to actually work. And if we cut off the process, we cut off the wonderful ability to vet things with a lot of minds brought to bear on them. And that's what this process is supposed to be about. That's what I think the public wants it to be about. And if we just bring in stuff where nobody really has an opportunity to do that, we can't. And that's how mistakes get made. This is a committee where we're supposed to really vet things.
Representative Zerwas.
Well, Mr. Chair, members, I just don't believe the argument that you didn't submit amendments because you weren't sure if there was going to possibly maybe be a substantive amendment that might impact that might impact the spreadsheet. So because that might happen, you didn't submit more than 2 amendments. If you had priorities, we have the 24-hour rule. Put your priorities in. I put in a lot of priorities. I can't guarantee they're all going to be a part of this final product. But the idea that because there's an author's amendment now somehow yesterday you couldn't have put in an amendment, that's just not accurate. In fact, the 2 amendments that are submitted, one is already included and one is totally unimpacted by the change in the spreadsheet. Heck, if you'd have put in a 3rd amendment, maybe that one would have had a shot. But you didn't. You didn't. You knew the rules and you didn't put in any more amendments than that. And now you want to blame the chair. It just doesn't make sense to me.
Well, I think, members, it's you know, we always kind of face these deadlines and things have to move, and we've got orders from headquarters about when these things have to move out of Ways and Means and so forth, and our rules and the leadership's priorities and deadlines. But also, we try to do the best we can with moving things through that have had amendments. Representative Gruenhagen, you'll hear from, has had several bills that he couldn't get through the process. He wants to take a shot at an amendment. They're probably not going to work because they haven't been heard and they cost money or we're not sure. But he wants the opportunity to be heard, and as is his right for his constituents, and to move forward on the floor with amendments as well to express his priorities of what he would like to have if he had his way and in the priorities. And that's all normal, good, and healthy. You know, but I'm not going to say that Ways and Means is the next opportunity, and there's lots of opportunities there for amendments, because Ways and Means is not typically where we want to do policy or for that matter, finance priority decisions. But this is kind of the process we have before us. I think we've got a decent bill that reflects our priorities of not just one caucus, but of, I think, a pretty good hunk of Minnesota trying to move forward with a 0 target, which I'm not whining about or complaining about. It is what it is, so we're trying to do the best we can within that target, Representative Liebling.
Well, Mr. Chair, obviously you're not going to, accede to my request here, but I just do want to remind people that you can't offer amendments to a bill that isn't before you. And the significant author's amendment, which I did ask about in our last hearing, whether there would be one, I didn't get a really clear answer to that, but our position is that there should be a bill that's posted that pretty much represents at least what the chair is bringing forward that we can all respond to. And we didn't get that, Representative Zerwas, and I hope you'll remember your comments next session or the next time you're in the minority, because really, I think it's a bad process for the public. So I hope that whoever's in that chair won't do it. But if they do, I hope that you'll remember that, you took a very strong stand that it was perfectly okay to make a significant change to the bill and not have anybody have an opportunity to write amendments to that.
All right. So, members, I'm going to go ahead and move the A27 author's amendment, and I'm sorry. I'll move the D one. Where is that? Grab a copy. I'm going to go ahead and move the DE1 amendment, and then also to that, the A27. And I'm just going to go ahead and list the bills that are in your packet that are included within this. And I would just note that the $2 million that this relies upon came as a result of changes that we were notified of very late. This takes the opportunity of reprioritizing that in great extent. We have within that House File 2628. That is a bill regarding Minnesota family residency programs that we removed last year, and the funding for that was removed. I think that was really a step backwards for physician training for rural physicians in Minnesota, so we restore that. That's I think a really good move back forward. We have interactive video services for targeted case management. We have House File 2661, Children's Mental Health Collaborative, a demonstration project carried by Representative Pearson. We have House File 3191, which is an addition for Representative Miller's Safe Harbor bill for trafficked youth, another strong priority for the committee. And we also have $250,000 for the Ombudsman of Mental Health and Developmental Disabilities for Pearson. Those are the bills that are carried within A27. Questions? Representative Hamilton.
No, Mr. Chairman, it goes back to the discussion previously, and what I was going to comment on is that we all approved the minutes on April 14th, and the bill was posted 2 days ago. You made a motion to begin the meeting at 12:47. You had 28 testifiers to the bill, Mr. Chairman, and the meeting adjourned at 2:13 p.m. So I believe it's a tough job being a chair, there's no question about that, but I think you're extremely fair letting the public weigh in on that. We've had 2 days to read through the bill, and subsequently we had time to offer up amendments as well. But I just wanted to remind everybody that we did approve the minutes, so thank you, Mr. Chairman.
And thank you for moving approval of the minutes, Representative Hamilton. Appreciate that. Representative Loeffler.
Well, thank you, Mr. Chair, and you said that you got some late information that helped inform your a choice to take $2 million from the Consolidated Chemical Dependency Treatment Fund, and in the base bill, we're adding almost $6 million to solve the IMD problem for chemical dependency treatment. And with the explosion of opioid addiction, et cetera, it's hard to believe that that wouldn't have an impact. So can you give us more information about what you know, or do we need to have the department tell us more about what the impact of this might be on chemical dependency treatment across Minnesota?
In terms of that, we could get information from the department and get that to you, but from what I understand, that was money that became available very late. That's money that would not have been spent or deployed. So that is the understanding that I have, and would be happy to get you information from the department as I get it, and I'd be happy to request that for you.
Well, Mr. Chair, since I assume we're going to be asked to vote on this, which is taking $2 million from that, I'm wondering if the department has anyone here today who could give us information about what the impacts of this might be on the chemical dependency system of Minnesota.
Matt Burdick is here also. Oh. Welcome to the committee. Please introduce yourself for the record and proceed.
Thank you, Mr. Chairman. My name is Alex Kutza. I am the Chief Financial Officer for the Department of Human Services. Mr. Chair, Representative, this is funding from our admin side of the Chemical Dependency Treatment Fund, and so it is not impacting services to clients. As the Chairman stated, it is funding that we found out about fairly recently and let staff know about it.
Representative Loeffler.
Thank you, Mr. Chair. And Ms. Kutza, could you just give us a little more information about the admin side? Is that people within DHS, vacancies? And why did it suddenly become available? Have we gotten some additional federal funds, or?
Ms. Kutzka.
We would have loved to have been able to been informed of that and presented some contrasting priorities as well.
Sure, Mr. Chairman, Representative. So of each, I'm going to try and explain this, and if I have to come back and follow up, I'll get more information from the people who know about the fund more than I do. But out of every dollar that we spend, a certain percentage out of the CCDTF in funding that goes for services, there's a piece of that, a percentage that goes into the admin account. Depending on how much money is in the entitlement fund, or what we call the services side of the fund, then our admin fund is a percentage of that. After the February forecast, we did a projection on the non-dedicated funding, which this is included in, and it was higher than we had anticipated, so there was a balance in the fund. The admin side does pay for things like FTEs and things within our agency that support overall CCDTF funding for services, and that money is not allocated at this point.
Representative Loeffler.
Well, thank you, Mr. Chair. And I do think this is an example where it would be useful for all of us to have the same information so that we would have the same opportunities to set priorities. As I understand it from Ms. Kutza, we should probably looking at that automatic transfer to an administrative fund then if we've increased services to the point that we're overfunding administration. But there's certainly unmet needs in this area. I know we really reduced eligibility for publicly paid chemical dependency treatment in the past in order to meet the service budget, and so this is a key area that I think is still a priority, and would like to know how we can provide and get more information as these opportunities become available.
Representative Murphy.
Thank you, Representative Dean. Mr. Chair, and to the testifier, can you let me know if it is common practice for the Department of Human Services to report back to the legislature when there are freed up administrative funds?
Ms. Ketska.
Mr. Chairman, Representative, we provide a report on all of our non-dedicated revenue sources after the February forecast, which was a legislative report, so that information is contained in there.
And Mr. Chair?
Representative Murphy.
And to the testifier, so is that where the information was found?
Ms. Ketska.
Mr. Chairman, Representative, that's correct. And then we worked with staff to highlight, they asked for what information, which pieces of it could be used, and we highlighted that for them. But it is included in the legislative report.
And Mr. Chair?
Representative Murphy.
Thank you, Mr. Chair. And I think Representative Loeffler was getting at this, but is there any practice within the Department of Human Services to report that kind of information to the legislature while we're in session other than in a forecasting document?
Ms. Ketska.
Mr. Chair, Representative, not that I'm aware of. It would just be in the legislative report, unless we're specifically asked.
Thank you.
Representative Liebling.
Thank you, Mr. Chair. And I just wonder, not for the testifier, but maybe for Mr. Berg or for the chair, whether there's a new spreadsheet or, any document that shows these changes from this bill, from this amendment, because, obviously there's $2 million, as I read it, going from the Chemical Dependency Treatment Fund to the general fund. And then I just want to see what is the effect of the amendment, this significant amendment on the spreadsheet.
Mr. Berg.
Mr. Chair, Representative Liebling, I don't have a spreadsheet at this point that reflects the 827 amendment. After committee actions today on that and other amendments, I'll post a new spreadsheet likely later this afternoon or evening. In regards to the specific item of the $2 million on that, the way that will look is it just simply reduces the cost of Representative Baker's House File 2609, House File 3026 by $2 million. It transfers in that administrative money and makes that initiative cost $2 million less in new money.
Representative Liebling.
Thank you, Mr. Chair. Thank you, Mr. Berg. Are there other changes, though, in the amendment, other than that one? Fiscal changes?
I don't believe so. Mr. Berg.
Mr. Chair, Representative Liebling, I can go. The chair mentioned the new bills that are in. I have a list which I can go through, but it is essentially the list that the chair just mentioned. If you would like me to go through the bill numbers and the appropriations, I can do that.
Right. So, Mr. Chair.
Representative Liebling.
Right. Mr. Berg, well, I think that would be probably helpful because there are some items of cost in there. And I'm actually rather surprised there isn't a spreadsheet, anything for us to look at here, because surely, when the chair was figuring out what he could put in the bill, in the amendment, and whether it be paid for, there has to be something. I mean, I don't know if it's just me, but I have a great deal of difficulty reading the bill language and the way the numbers are in there and actually figuring out what's happening and what's going where. And I think that's why usually our fiscal staff issues to us, well, not only do we get a spreadsheet of what the bill is doing and how it compares to the governor's recommendations, but we also get this other House HHS finance items, wonderful little changes sheet that we all had, and I don't know why we wouldn't have something like that for this significant amendment that's before us. So I think it probably would behoove us to go through that, Mr. Berg, if you wouldn't mind, and just, you know, tell us. It's, of course, a lot harder to understand without any kind of visual, but I think that would be better than nothing, at least.
Well, Representative Liebling, I think we're trying to, we don't obviously know what the bill is going to look like coming out of the committee until we adopt amendments and update that. I think we could probably get you something within a half hour and probably be a better use of committee time if that would satisfy you. But we never know what the spreadsheet is going to look like coming out of the committee until we pass the amendments. And as I said, we've got a great number of amendments before us.
Well, Mr. Chair, I think that's certainly true, you know, that we don't exactly know, but certainly when the chair brings an author's amendment, I think it's pretty safe to say that's going to go on the bill. Generally speaking, I think the chair probably discusses it with the members in that person's caucus so that those members aren't surprised. And I do want to note that when we had the public testimony on the bill, we had testimony about the contingent fund that's being created for the 5% campaign. And it's interesting to note that at that time, that wasn't in the bill. But obviously, people were testifying about something that they knew was going to be in the bill. However, you know, that information wasn't shared with the entire public. So, I mean, again, we have some significant concerns about the process here. And I get it that you want to zip through this. None of us really wants to be here on a lovely Friday afternoon. I'm sure the audience feels the same way. But, you know, we're making significant changes here, and I think before we vote on them, I think members have a right to know, even though we can't impact them, obviously, because we don't have the time to do that, but we should at least know what we're voting on.
All right, thank you, Representative Liebling, and we will try to get you an updated list. Mr. Berg can read through that, but I think it will just be a list of the bills, their costs, and the revenue, which we can have somebody type up for you very, very quickly. But before we do that, I just want to go ahead and adopt the DE1 amendment. All those in favor, please say aye. Aye. Opposed, no.
No.
DE1 is adopted, and the A27 amendment to that. All those in favor, please say aye. Aye. Those opposed, no.
No.
A27 is adopted and amended to the DE1. Members, if you look in the packets, I think we'll just go through the amendments in numerical order. And first up, we have Schumacher, the A16 Schumacher amendment. Representative Schumacher. Representative Schumacher moves the A16 1075.
Thank you, Mr. Chair and members. This deals with the Jensen settlement. It was a bill that Representative Loon was carrying this session. Basically, with that settlement, the child care centers were inadvertently lumped in with the adult group home settings, and this bill requires a report to be put together, a written plan for modifying the application of rules to make sure that the child care centers aren't included with the adult group home settings. Basically, the problems that come up is that there are regulations when you're dealing with adult group homes that you don't have with child care, such as being able to lift a child and that sort of thing. And so there's been a little consternation there with with how that process goes. I understand that DHS has some concerns with that that they don't really know how this would impact the settlement overall, but we're just requesting that written plan to modify the application of rules be submitted by January 15th of next year.
All right. Questions for Representative Schumacher. Representative Liebling.
Thank you, Mr. Chair. We're just still trying to find the amendment. I think some of us kind of
Okay,
bury
there's
in
a
the
big
back.
stack in there.
Yeah.
Mr. Chairman.
I don't have it in that.
Oh, I think
Mr.
All
Chairman.
right, we're going to wait until members can grab a hold of that. Representative Hamilton.
Mr. Chairman, it's in the green.
It's in the green folder.
Folder, separate green folder.
not all of it.
Passed out. Okay.
So slicky.
Check the slicky. All right, we'll work with the pages here to make sure that everybody has a copy of it in front of them before we take action or further discussion. Representative Loeffler.
Well, thank you, Mr. Chair. This is a new one, and hearing that DHS has some concerns. I also have some concerns about, does this apply to any kind of child care, including child care for children with disabilities? You know, the applicability isn't really clear to me in terms of, is it all children, all settings? If Representative Schumacher or others could better explain the implications and the need for this.
Representative Schumacher.
Yes, we have a testifier coming down now that can help you, Representative Loeffler, with that question.
Welcome to the committee, Ms. Sanford. Please introduce yourself and proceed.
Thank you, Mr. Chairman. Representative, I am Claire Sanford. I represent the Minnesota Child Care Association. And to answer your question about does this apply to children with disabilities or settings where children with disabilities are cared for, we represent typical child care centers licensed under Rule 3 under the Department of Human Services, and we are your average community child care providers. We serve typically developing children and many children with various forms of disabilities. As we understand the positive supports rule, the types of disabilities that this rule applies to are pretty specific, and we don't serve a ton of children who are affected by those specific disabilities, but we do serve a percentage of them, and we just have concerns that some of the training requirements, most specifically here, would be burdensome for child care providers, and we fear that typical child care providers may look at this and feel that they can no longer accept children with some of these disabilities because of the burden of the training. So we're just looking to have this, basically to have a little more time to work with the Department of Human Services to make sure we can get this appropriately applied to early childhood settings with typically developing children most of the time, but also some children who are covered by these qualifying disabilities.
Representative Loeffler.
Well, thank you, Mr. Chair. And most parents have to work, and whether their child is disabled or not. And I'm concerned about some broad language that seems to exempt child care providers from having to respectfully deal with children with challenging behaviors and disabilities. And I'm wondering if we could have the Department of Human Services share with us a bit of their concerns, since it was mentioned that they have issues with this, and we certainly would not want to authorize the use of inappropriate interactions with people with disabilities just because they're of childcare age. In fact, that's probably when it's much more difficult for them to even understand what the rules and behavior expectations are. It's hard to work with sometimes 2-year-olds of any ability, let alone, for example, I have a constituent who has a deaf-blind child. It's taking that child much, much longer to understand how to interact with people, and we're writing laws for all children, all childcare, and so I appreciate seeing someone from the department here. Welcome, Ms. Bartolik.
Welcome to the committee, Ms. Bartolik. Please introduce yourself and proceed.
My name is Alex Bartolik. I am with the Department of Human Services, and I appreciate the opportunity to offer clarification. The positive support rule is applicable to all providers of 245D services, which are specifically for people with disabilities, and to other DHS licensed providers when they serve a person with a developmental disability. And we know, we've been in contact, we've been working through here, that it's been concerning about, will there be more training, will there be more requirements? As we've been looking at this, child care centers already do quite a bit of training on how to work with children. So it isn't you do all this training and you do all this training, it's how much of this training can be combined. And if there are children where there is concern about their behavior and an ability to work with it, on how to give some additional tools to the providers to be able to reach out, work with the family differently, or get some additional support.
Representative Loeffler.
Thank you, Mr. Chair, and I think that's helpful, and I am uncomfortable at this point, given that explanation, to totally exempt these facility, childcare facilities who are serving children with disabilities from the expectations, but I'm glad to hear that there's discussions going on to streamline the training and make it applicable. But to put it in law, that when they serve a disabled child, they don't have to comply with our expectations of, respectful, appropriate interaction with the child with that, I think would be a move too far at this point, particularly when it hasn't had a full hearing and we haven't been able to hear from the advocates in this area or parents who might be affected. So I would ask for a roll call on this.
Roll call having been requested, there will be a roll call. Further discussion to the Schumacher A16-1075 amendment. Ms. Lipson.
Thank you, Mr. Chair. I'd just like to clarify something. On behalf of the Minnesota Child Care Association, I'd like to commend the Department of Human Services because we have been working together on this very well and working towards a solution that is amenable to all parties. And we as child care providers in no way are asking to be exempted in full from this rule. We agree with the intent of the rule. We don't want any child, whether or not they have disabilities, to be inappropriately restrained or secluded from activities or anything like that. We are not asking for a complete exemption. We are just asking basically to move this out until January, whatever, January 17th, I think, is in the amendment. So we have more time to work with DHS to figure out how to most appropriately apply this specifically to child care settings. And I just wanted to clarify that. We are not looking for a straight, complete exemption. We agree with the intent of the rule. We just want to make sure it can be applied appropriately to our settings.
Representative Loeffler.
Mr. Chair, the amendment before us does not have that one-year limitation. It is a permanent change effective upon enactment. And so I think we should consider that as we vote on this.
I understand. Other discussion. Ms. Aves.
Mr. Chair and members, this amendment exempts the child care programs from two parts of the rule. The functional behavioral assessments and the staff qualification and trainings until the report is submitted. They're still subject to the emergency use of manual restraints, the prohibitions and restrictions against restraints, the permitted procedures, the things they're allowed to do, documentation and record-keeping requirements, reporting on use of restrictive interventions and incidents. It's only two parts of the rules that they're exempt from.
Thank you, Ms. Aves. And this is not Representative Schumacher's bill. This actually was a bill carried by Representative Lewin, House File 3495. Further discussion. Representative Liebling.
Thank you, Mr. Chair. And so could I ask the testifier there for the Child Care Association, so what is it about, the staff qualifications and training piece, what is it that you don't want to have to do between now and January 15th, 2017?
Ms. Sanford.
Mr. Chair, Representative, the main concern we have is the amount of training laid out in the rule. The amount of training that child care providers are required to access currently in the positive supports rule is between 8 and 14 hours in the first year, and that is for all people who work at a child care center that serves at least one child who has a qualifying disability. And for our field, we feel that That on its face is very burdensome, and we don't know that we would be able to meet that training requirement in our industry without restricting access to children and families. So we are working with the Department of Human Services because we are trying to figure out a way that that is not 8 to 14 hours in addition to the roughly 40 hours that our early childhood teachers are already doing on an annual basis. But we're trying to figure out how much of that is already covered in what we do and what might need to be added. So, did that clarify? I'm sorry.
Well, it may, Mr. Chair.
Representative Liebling.
Ms. Bartalik, could you kind of react to that as well?
Ms. Bartalik.
Yes, I think the issue is how much of the current training that child care providers go through covers items that are already there, and what are the perhaps very limited amount that is unique to the rule. And so we are in the process of working through the training side by side. We are working with the child care licensors to assure that we are all in agreement, so when they are going out, we are having the same standard.
So,
Representative Liebling.
well, Mr. Chair, so Ms. Bartalik, if this amendment does not go on, what would happen if there's no agreement happening by January 15, 2017?
Ms. Bartalik.
So if the amendment doesn't go on, the child care providers are held to the rule, and we are going to be working to provide administrative guidance on this is how you can interpret the training requirements. We will be developing training to make it available if there is additional training that's required. So we would be working with the Child Care Association and providers to try to streamline the training and be as clear as possible about what's unique to the rule.
Okay, thank you.
Further discussion? Seeing no further discussion, the clerk will take the roll on the amendment.
Chair Dean.
Yes.
Vice Chair McDonald.
Yes.
Representative Liebling.
No.
Representative Loeffler.
No.
Representative Allen.
No.
Representative Backer.
Yes.
Representative Franson.
Yes.
Representative Grunhagen.
Yes.
Representative Halverson.
No.
Representative Hamilton.
Yes.
Representative Lane.
No.
Representative Lohmer.
Yes.
Representative Mack.
Yes.
Representative Murphy.
Yes.
Representative Purcell. Representative Pearson.
Yes.
Representative Schoen.
Yes.
Representative Schumacher.
Yes.
Representative Zerwas.
Yes.
There being 13 ayes and 5 nays, the A16 1074 is adopted. 75, sorry.
So that's 30 minutes.
Yep. Just so folks know, the next in line, the A16 1076 is withdrawn. The A16 1079 is withdrawn. The A16 1080 is withdrawn. The A16 1082. You want to talk to that?
Yeah.
Okay. Representative Grunhagen to the A16 1082.
Oh, thank you, Mr. Chair. What this amendment does, members, on March 1st, 2016, the U.S. Supreme Court ruled 6-2 that self-funded companies are not required to submit data to state all-payer claims databases as a result of the protections they have under the federal ERISA law. Given the Supreme Court ruling, this amendment makes it clear in Minnesota law that self-funded companies and their third-party administrators are not required to submit patient encounter and pricing data to Minnesota's all-payer claims database. I don't believe there's any cost to this amendment, so, Mr. Chair, I would move the acceptance of
it. Discussion. Does someone from the department want to come? Welcome to the committee, Mr. Pollack. Please introduce yourself for the record and proceed with your testimony.
Mr. Chair, Deputy Commissioner Dan Pollack, Department of Health. Just to verify, we're the A16 1079.
Nope. 1082.
1082. So, Mr. Chair, we didn't see this until last night, so we haven't had a chance to really offer any technical assistance to Representative Gruenhagen on this proposal or concept. I think we have some concerns, both legal and policy, about how to implement it, and depending on how much time you'd like to spend on that, we can articulate those, or we can wait for a better time.
Representative Liebling.
Thank you, Mr. Chair. And Mr. Pollack, I don't know if you can help me with this. I hear what you just said. You haven't had enough time. Kind of puts you in the same boat as many of us. But I understand there's a Supreme Court case about this, and that exempts ERISA plans from this kind of disclosure. But my question, if you know, or maybe if the author of the amendment knows, is this simply bringing us into compliance with that, or does it extend beyond the scope of what that decision required?
Mr. Pollack.
Mr. Chair, Representative Liebling, this amendment does not bring us into compliance with the decision. We're actually in discussions right now with the Attorney General's office about how to comply with that decision. We've heard a variety of interest from self-insured employers about continuing to participate in the All-Payer Claims database, which is a database that's longstanding in Minnesota, predates the Affordable Care Act. It's part of Minnesota's traditional healthcare reform and cost and quality analysis.
Representative Liebling.
Thank you, Mr. Chair. So if I'm understanding, when you say it does not comply, are you saying that it might go beyond what the Supreme Court is saying we have to do and exempt a lot more than what we would otherwise have to exempt? Because I understand what this is dealing with is kind of weakening that database, which is actually very valuable to us in trying to manage our health care in Minnesota. And so if this is going, I guess that's my real concern. Is it going beyond that? If you're saying it doesn't comply, I just want to be clear if you're saying it probably does more than what we would otherwise have to do.
Mr. Chair, Representative Liebling, that's correct.
All right. Representative Gruenhagen.
My understanding of the amendment is that it would send the message to the department to comply with the notification to the groups that are third-party administrator, that they do not have to submit patient encounter and pricing data on all payer claims database, and it's pretty straightforward according to the information I have.
All right, and Representative Gruenhagen, this has not received a hearing yet?
No.
Or a fiscal note, correct?
Correct.
Correct.
There should be no fiscal note,
okay.
My understanding.
Okay, somebody from the department, let us know if there could be a cost involved.
Mr. Chair, I haven't discussed this with our budget staff. I think, to Representative Gruenhagen's concern, we are in the process of working on that notification, and I know that it is concerning to some of the stakeholders. The reason it's been delayed is because of that Attorney General's office consultation. So what we're trying to do is avoid a lawsuit against the state for doing the notification wrong.
Okay. Yeah, I guess I don't really understand the full implications of the bill, not having heard it or seen it, and the costs. I would encourage members not to support the 1082. Representative Gruenhagen.
Mr. Chair, with that, without your support, I would say I'd withdraw the amendment.
All right, 1082 is withdrawn. All right. All right, next, members, I just want to grab quickly the A16 1074 amendment in your packet. And the A16-1074, which I will move, is just reviser's instructions. The reviser asked us for this amendment just to correct a few bad references in the bill. Any questions to that? Seeing none, all those in favor of adoption of the 1074 amendment, please say aye. Aye. Those opposed, no. 1074 is adopted.
I gave you different ones.
Representative Gruenhagen, would you like to speak to the A16-1082A1 or A2?
The A16-1082.
It'd be A2.
Oh, the A2. Okay, I had that. Here it is. Yeah, what this A2 amendment has passed committee. It's on its way to the House floor. This is just providing an additional vehicle on this bill. It basically requires providers to allow an initial on a patient consent form for the different release of medical information and consent for treatment, and also the release of medical records. Some providers in the state already do this. A number of them have only one signature for all release, and according to testimony in the committee, in some cases, patients are being told you have to sign and accept the entire document, or we won't give you treatment, which, based on testimony in the committees, is not true. So I would like to see this as a part of the Omnibus bill also, and I would move the amendment.
All right, Representative Gruenhagen moves the A16-1082A2 amendment, and you're saying, I'm sorry, I read that wrong. The A2. The Representative Gruenhagen, from my recollection, this is a consent sheet, and rather than having a blanket consent sheet, it has initials on each parts of it, so it's more specific. That this is already passed and on the way to the floor? Or
yeah, it's on the House.
On General Register?
General Register.
Okay. I remember the bill, and I would support the amendment. Representative Schoen. No? I'm good. Okay. For the moment. Representative Liebling.
Thank you, Mr. Chair. And I recall that, I don't exactly recall who testified on this when it came through, but, while I agree with the general principle that providers shouldn't be able to condition the patient's receipt of treatment on their willingness to release, at least, to release records, at least in many circumstances, I think that this imposes a real burden on providers. I think there should be a way to do this, but I think that this idea of having a bunch of yes and no items on it is really just administratively really difficult. And this, not conditioning the treatment on willingness to release records. So I think, Representative Gruenhagen, I probably agree with you more than disagree, but there are some records that if the provider can't release them, they may not be able to get paid. So, for example, what you might be saying here is that if the patient says, don't tell my insurer about my being here or something, they may not be able to get paid for the visit. So, while I would absolutely agree that they shouldn't, if a person should be able to say, I don't want my data used in research, I don't want my data sent to other providers, et cetera, I actually think that this is a policy that needs to be much more carefully considered because it, so I don't know. I suppose if it goes on the bill today, I think it has an opportunity to be considered further. So, I guess I'm kind of very ambivalent about it, because I agree with the underlying sentiment, but I just think that as a practical matter, it puts an incredible burden on a lot of providers to have to get the yes or no to every single piece of consent and then somehow keep track of that. And, I'm sure there's a cost. I don't think it's probably a state cost, but I think there's probably a huge cost to providers that would come out of this. So, that's all I'm going to say. I'm not going to tell members to vote no, but I just think I just hope that you'll give it a lot more work and talk to more providers as this thing goes forward, because I think you may be jeopardizing a lot more than you think here.
Representative Schoen.
Thank you, Mr. Chair, and if it's Representative Gruenhagen or someone else can answer this. The part that I'm curious about is actually does come into may not condition the patient's receipt of treatment on patient's willingness to release records. And so my curiosity stems from, if I have a special condition and I get referred to someone and basically, if the specialist says if I can't get the records, I can't treat you, is that going to be a problem for the patient? If there is a malalignment of signing, or accidental signing, or forgot to check the box or something like that. I mean, I'm with you on the concept of privacy, but also, when HIPAA first came out, we were handing out stacks of paperwork to make sure people knew that they had privacy issues. You had to check a box with an unconscious person in the ambulance to say that you gave them the form, so you'd tuck it in their shirt pocket. When they got brought into the emergency room, it just got to a ridiculous point, of certain things. And so, can you tell me that, would this prohibit even a doctor saying I can't treat you if I don't get your medical records? Does it go to those extremes with that sentence in there, the way it's phrased?
Representative Gruenhagen.
Oh, thank you, Mr. Chair. Thanks for that question, Representative Schoen. As I said before, there's already providers doing this, okay? Having the initials on both sides, and during the testimony at two committees on this bill, it was not brought up that was a problem. Now, if it was a problem, I'm sure the provider can notify the patient about the concern, and the patient can make the decision at that particular point. But this just allows patients to understand that they don't have to sign a blanket form, that they can pick and choose which information they want released. And the concern comes from, under the electronic healthcare records and the ACA, that your medical records are transferred to areas that you're not aware of, and this just makes it a little plainer. And again, the question you're bringing up was not brought up as a concern during the last two committee meetings.
Thank you, Mr. Chair. I'm not trying to oppose the measure and the concept. I'm just, even if someone here on staff can say, does the way that's written make it seem like that could be a possibility? But if you say it doesn't brought up, then it wasn't brought up. But I just think it's something that you might want to ask before it gets to the floor.
Thank you, Representative Schoen. Representative Murphy.
Thanks, Mr. Chair. And Representative Gruenhagen, where else was this bill heard in the Minnesota House?
Representative Gruenhagen.
Oh, thank you, Mr. Chair. Representative Murphy was heard in civil law and I believe HHS policy.
Thank you. And Mr. Chair and Representative Gruenhagen, was there any debate about potential liability for providers if they are unable to ascertain a complete medical record, and then they are caring for somebody and they are blinded to what may be potential conditions and treating without that knowledge?
Representative Gruenhagen.
Thank you, Mr. Chair. Representative Murphy. It didn't come up because I think one of the things, again, is there are providers using this form already, and that it didn't seem to be a concern, and nobody really testified into that particular area where your question was.
Mr. Chair and Representative Gruenhagen, as a nurse who cared for patients I was a surgical nurse, so we relied a lot on the record. because our patient was asleep and we couldn't ask them questions about their condition. And so if a part of the record is missing or it doesn't travel with the patient, I think that poses concerns for patient safety. So as we proceed with this, you may want to inquire with some of the other providers or the organizations that represent them.
Mr. Chair,
Representative Gruenhagen.
I'm always open to additional information.
Representative Liebling.
Thank you, Mr. Chair, and I was just going to kind of go a little bit along the lines that Representative Schoen was discussing, that I think that under this language, it's pretty clear the provider may not condition the patient's receipt of treatment on the patient's willingness to release records. So I think that does put a provider in the situation where if the patient says, you know, you can't find out whether I had surgery for this before, or you can't find out whether I had, you know, I'm on a certain drug because I'm getting it from another provider. They can't refuse to treat on that basis. And I think that that may very well create a big problem. I'm also kind of wondering along those lines, you've got the, you know, we've got the much discussed PMP program, right? The prescription monitoring program that does just exactly this. I'm going to pause here so Representative Gruenhagen can listen. Okay, sorry, I didn't want to talk to you while you're discussing with staff, but
that was an angel that just showed up. That was
sure. Okay, they usually are. So we've got the prescription monitoring program, Representative Gruenhagen, and I wonder, you know, that is in fact a program where a patient's records are released to a provider, and then to other providers without the patient's permission. That's explicitly what it does, at least as in terms of what prescription, whether they're taking opioids. So I wonder how this might interact with that.
Mr. Chair.
Representative Gruenhagen.
Yeah, again, that did not seem to come up in the previous two committee meetings, and I will again reiterate the fact that there are providers already doing this in the state of Minnesota, and I will be willing to look at the clause and get further clarification on the provider may not condition the patient's receipt of treatment between here and Ways and Means or after the meeting is completed here.
Representative Schoen.
Thank you, Mr. Chair, and I appreciate that, Representative Gruenhagen. I guess what I was getting at is that statement, what my fear is if my doctor should be telling me if I can't release these records, it's going to be detrimental to your care, something along that lines in that direction. It shouldn't be harmful to that physician or care provider, whether it's a doctor, APRN, or otherwise, and that's what I want to make sure that's not in the language.
Mr. Chair, again, I have a lot of faith in the doctor-patient relationship, and if that's a concern in a particular area, I'm sure the doctor-patient can work that out without the micromanagement of having a form signed that releases everything across the board on the patient's medical records.
All right. All those in favor of adoption of the A2 amendment, please say aye.
Aye.
Those opposed, no.
No.
The A2 amendment is adopted. Representative Gruenhagen, Tier A1 amendment.
Oh, thank you, Mr. Chair. This amendment does have a cost to it, but I did want to speak to it. And one of the things I've noticed on our public assistance programs, and even Obamacare and MNsure, is that government programs tend to penalize two-parent family situations and actually subsidize and incentivize breaking up that situation and undermining it. And I think that's a major concern. And I just want to give a couple examples. You can look up and do some research on your own, the marriage penalty in Obamacare. And you'll find articles on the internet. If I have two single people, young people, and they each earn $30,000, they can qualify for a subsidy towards the purchase of their health insurance under MNsure and Obamacare. However, let's just say that amount is $1,500 each. If they decide to get married, they have to stack their income, and now instead of $30,000, they have to look for a subsidy up to $60,000 income. The result is they either lose their subsidy or it's significantly reduced, and therefore it's a disincentive to actually get married. I'll give you one more example, and you can find this article also on the internet. If you have a man and a wife, and the man earns $110,370 a year, and he's married and has 3 children, he can qualify, according to the Kaiser Foundation's analysis, for about a $9,600 subsidy towards the purchase of his family health insurance under MNsure and Obamacare. However, if he gets a $1 raise the next year, he will lose the $9,600. So why would he want to get a raise? Now, if he does get a raise, his best economic option is to divorce his wife, sign up for health insurance on his own, pay his own premium, and have his ex-wife with children apply for a subsidy under MNsure, which they could then qualify for because they're now divorced rather than married. I'll give just 2 more quick examples. And the reason I'm putting this out there, members, and for the people in the audience, somehow we have to figure out to reinforce marriage rather than undermine it. All the studies show that children do best and with a 2-parent family, and the amount of dependency on government goes down dramatically if we can figure out how to reinforce the traditional family rather than undermine it. I'll give you another example. Last session, when we had agency heads here from the department on the welfare program, I asked the question, if a woman with small children gets married, who's on welfare, does the husband's income reduce her welfare benefits or eliminate them? And the answer is yes, it does, by the department heads. And I think that's reasonable, okay? However, if a woman lives with a man who fathered her children but they're not married, it also reduces or eliminates her welfare benefits. So again, if a woman lives with a man who fathered her children and they're not married, according to the agency head's response, and you can look at the tape, it also eliminates or reduces her welfare benefits. However, members and ladies and gentlemen of the audience, if a woman lives with a man who did not father her children, it does not affect her welfare benefits. So we are subsidizing living with men who did not father their children. Just an additional antidote. Where is the chance of child abuse the highest? Not always the case, but when a woman lives with a man who did not father her children. And I'll give you an example. Adrian Peterson's son, his ex-girlfriend was living with a man that did not father the little boy. And that boy was killed by that man, and that happened to be Adrian Peterson's son. So people are still responsible for their decisions, but the government is undermining the family through its welfare and subsidy program. Last comment, or did I say that already? No. Okay.
Oh, please carry on.
Yeah. Prior to 1965, the black family in this country had out-of-wedlock births under 20%, according to the information I have. Today, black families have out-of-wedlock births of over 70%. That means 7 out of 10 black children are born out of wedlock. Now, again, people are still responsible for their actions. But when you subsidize the undermining and breakup of the family, you cannot print up enough money to take care of all the problems that come out of it, okay? And that's my experience not only as an insurance agent, I've seen this. After 13 years of jail ministry, I wasn't in jail, Representative Schoen, no. I've seen the results. So members, I think what this bill, the amendment did, it was in the form of a bill, was request a study by the department to figure out how we can do a better job of reinforcing traditional families and not undermining them. With that, Mr. Chair, I'll withdraw the amendment.
Thank you, Representative Gruenhagen. Representative Gruenhagen withdraws the A1 amendment. All right. Next up, we have the A3 amendment. Representative Gruenhagen.
Pardon? A3. I was just trying to get over the last one.
So were we.
So which one are we on? A3. Oh, the A3. Okay. This is non-controversial. What this amendment would do is allow open enrollment of individual health insurance, not just within a few months of a year, but over the entire year, so that if people's situations change or if they didn't take health insurance and now they have employment where they can afford health insurance and they don't fall into one of the current exemptions, they can take out an individual health insurance policy. The reason this is important, we need more people taking individual health insurance if you want to hope to pay for MNsure in any way. I just assume MNsure go away and we use the federal exchange, but the point is we are killing the individual market in this state. As I mentioned yesterday, one of the providers in the MNsure lost $260 million last year on their individual policy. This is not sustainable, okay? So we need more people on the individual roles. My personal position is if we don't, we're going to see things like United Healthcare and Preferred One that pull out of MNsure, and you're going to see a further collapse of the individual market and MNsure and Obamacare across the nation. I know I've referred to it as a healthcare Titanic in the past, but if we don't stop the hemorrhaging, members, the ship's going to sink a lot faster. Right? And so this attempts to allow people to participate in the individual market. With that, I would stand for questions, Mr. Chair.
Representative Liebling.
Thank you, Mr. Chair. And I'm not really seeing how, well, Representative Gruenhagen, you were talking about this, we need to do this to help MNsure. To make sure that it does, that we keep people in private plans so that it helps MNsure. But this is about, as I'm reading this amendment, it looks like it's about sort of strengthening the non-MNsure part of the market for private plans. And those, as far as I know, don't pay the premium assessment to MNsure. So this, to me, looks like it's sucking more plans out of MNsure. And so I think that it probably does have a lot of cost, but also I think there might be a problem with federal law on this, Mr. Chair, and I wonder if we could get the Commerce Department to come down and talk about that.
Mr. Chair, could I make a quick follow-up comment?
Representative Gruenhagen.
You know, I'm going to have to accept that correction, Representative Liebling. It affects the plans outside of MNsure, you're correct. And it would allow people who do not fall into the exemptions where where their coverage is terminated or they get married, and there's a number of exemptions that allow them year-round enrollment. This would actually allow a person, if he wasn't able to get health insurance for some reason. He got a job where he earned enough money where he could now sign up, and it was outside the enrollment period. He could take out his own individual health insurance plan.
Representative Lee.
Or she.
Right, well, thank you for that correction, Representative Grunhey. I think, though, that, right now, I think, and Mr. Brickwitty's there, so he can probably help us, although I can't see him, but I think that right now, if you have a life change, then the open enrollment doesn't apply to you, and you can, so if you lose a job, I believe that allows you to go out and buy a policy, even if it's not during that open enrollment period. So that already applies now. And what I'm reading this amendment as is it's just basically removing any requirement for an open enrollment period, so that anytime a person just plain old decided they wanted something different, they could go and buy it, but only off of MNsure. So anyway, I'd like Mr. Brickwitty from Commerce to speak to this amendment and whether the Commerce Department has an opinion on it.
Welcome back to the committee, Mr. Brickwitty.
Mr. Chairman,
Introduce yourself and proceed.
Mr. Chairman, Peter Brickwitty, Assistant Commissioner from the Commerce Department. Representative Liebling, I would probably defer to staff from MNsure on specific questions about special enrollment periods, because that's under MNsure's purview. But I would say that the open enrollment period is fixed as a defined set of time by the federal government. So Minnesota does not choose or define when open enrollment will occur. And so any change in when open enrollment would occur that the state would want to undertake on its own would require a federal waiver.
Okay, and
Representative Levy.
Thank you, Mr. Chair. And so I assume that there's, since a lot of the bills we hear here that ask for federal waivers have costs attached to them, I assume that trying to get such a waiver probably has a cost attached to it, Mr. Brickwitty?
Mr. Brickwitty.
Mr. Chairman, Representative, I believe that would likely be the case.
Okay. Thank you, Mr. Chair.
Representative Loeffler.
Well, thank you, Mr. Chair, and I think this would actually put quite a burden on the health insurance industry, because they'd have to really change their actuarial models and their ability to predict cash flow over the year if we got rid of open enrollment. And while it's a interesting intellectual idea, it really, I think, believes is really not within the major jurisdiction of this committee and really deserves a full hearing in the Commerce Committee, where the insurance companies that would be impacted could have a chance to weigh in on whether this would increase insurance costs, because it would change their ability to manage that actuarially. And so I would respectfully think that this should be pursued as a separate bill and let the Commerce Committee and its experts weigh in.
Representative Gruenhagen.
Yeah, I did introduce it as a separate bill, and but it didn't make it through the process. So I just think it's a hardship on people who now can work and afford individual health insurance, and yet they will find themselves blocked out from taking a policy out unless they fall within one of the current exemptions. And this just says that rather than micromanaging those exemptions, we should allow those individuals to obtain the health care. I'll give you an example from my own insurance business. I had a business owner who saw his new premium from the health plans, and he because of the huge increase, he said, I'm not paying this premium. I don't care what anybody says. So he canceled his health insurance. Well, he waited till outside the enrollment period, and he had some remorse about that. Not because he had a health problem, but he had remorse about it, but now he's basically blocked out of the enrollment period. And, so it's a hardship for him and other people that find themselves in circumstances where they can't qualify under one of the exemptions.
Ms. Commit, please introduce yourself for the record and proceed. If you could comment on the amendment.
Amendment. Thank you, Chairman Dean and members of the committee. It's Catherine Commit from the Minnesota Council of Health Plans. And I would like to make some comments about the A3 amendment. We're sympathetic to the challenges that agents and brokers have had with people trying to obtain coverage in the individual market, but we also have serious concerns that this particular amendment could harm the individual market. And I'll just give you an example. In Massachusetts, in the mid-2000s, they allowed people to enroll in individual health insurance coverage at any time of the year. And the fines for not having health insurance coverage were very small compared to the cost of having insurance. And then as the state analyzed the impact of the law, it found that two factors resulted in a small but expensive phenomenon. And some people in Massachusetts were jumping onto coverage when they needed health services and then dumping the coverage after they received the treatment they needed. And this practice was coined as a new term in Massachusetts called jumpers and dumpers. These individuals, according to one study, cost the Massachusetts health insurance market between $29.3 million to $37.3 million in 2009. You know, I know that members sitting at this table are hearing a lot from individuals who saw their individual health insurance premiums go up, in some cases quite a bit. And this particular amendment would only serve to further disrupt the individual market, further create more volatility, and frankly, the only people who would be in the insurance market would be the people who needed insurance. The healthy risk would stay out of the insurance market. And so we really believe it's not a good approach to take for the health insurance market. For those who buy it individually. Thank you.
Representative Grunhagen.
Oh, thank you for that testimony. As usual, I should have probably talked to you before I introduced the amendment. But I appreciate that perspective, and I do understand the jumper and dumper principle to a certain degree. The other thing I just share with members and people in the audience is, you know, when you eliminate underwriting from an insurance product, okay, you destroy that insurance market and you destroy the ability for people to afford it. Let me just give you two examples. What if on auto insurance, if someone had 5 DWIs and you had none, you both got the same auto insurance premium and the same benefits? What would happen to your auto insurance rates? They would skyrocket. If you had property insurance where a brand new home, well taken care of, got the same premium and benefits as a house that was in disrepair and had major problems with it, guess what would happen to your property insurance rates? They would skyrocket. So when you do that to health insurance, when you remove underwriting, you remove the cornerstone of a fiscally responsible insurance industry. And in Minnesota, we had MCHA, which allowed people who were uninsurable to get coverage. We could have tweaked that. But we're basically, and that's why I refer to it as a Titanic healthcare. There's no mechanism to keep this thing going forward, and no matter how you do it, you hurt people and put a hardship on them, whether through higher premiums or the inability to get health insurance when they need it. So with that, Mr. Chair, I'll withdraw the amendment.
Mr. McAlpin, did you want to testify? Oh, all right. All right. I thought you came down to testify. All right. The A3 is withdrawn. All right. Next up, we have the A6 Zerwas amendment. Representative Zerwas moves the A6 amendment. Representative Zerwas, to your amendment.
Mr. Chair and members, the A6 amendment is one subdivision of the Minnesota Department of Health policy bill that I'm carrying that's on the General Register currently. Just trying to find it a home. It's the special event food stand portion of the MDH policy bill.
Questions to the A6 amendment? Seeing no questions, all those in favor of adoption of the A6 amendment, please say aye.
Aye.
Those opposed, no. The A6 amendment is adopted. Next up, we have the A7 amendment. Representative Pearson offers the A7 amendment. Representative Pearson moves the A7. Representative Pearson to the A7.
Well, thank you, Mr. Chair, and unwittingly, I've become extremely interested in the last 24 hours on the special event recreational camping area. My wife will not be happy to hear that. She's not a big fan of camping. But in all seriousness, this specific bill is basically trying to carve out an area of camping, of recreational camping that's popular in the state of Minnesota, where historical reenactments of Minnesota history or U.S. history are taking place. I do understand that there's actually different language that's being offered in the Senate bill, and we're going to continue to work to move forward with that. But the reason this falls under this committee is it falls under MDH. So you may be scratching your head wondering why a bill that I didn't originally author is now in my lap. So am I. I'll go on record as saying I would like to move the amendment, A7.
Representative Pearson moves the A7 amendment. And here is Mr. Pollack in his historical garb. Comment.
You know, Mr. Chair, I wasn't forewarned. I only had last night, but I'm sure we could all, as a committee, maybe take a field trip to the historical reenactment to see what a great job our environmental health staff do of protecting people in their historical reenactment. And Representative Pearson can come, and everybody will enjoy it. The one thing we would recommend is going with the Senate language or the House language, both of which have no cost. This language, unfortunately, is a little bit broader, so it actually could have some fiscal implications, but we're happy to work with Representative Pearson, and we were completely neutral in the Senate version. It just addresses the constituents' concerns.
Representative Liebling.
Well, thank you, Mr. Chair, and I guess I'd like to understand, what this means. I mean, special event recreational camping area, what's the effect of being designated that this is being exempted from? I mean, is that there must be some health regulations. So when people want to do this historical reenactment, are they wanting also to be exposed to historical diseases too, as to make it realistic, or what exactly is this about?
Exactly. Mr. Chair, Representative Liebling, yes, we want to maintain the health of people in their reenactment. We don't want any historic raw sewage or other contaminants to hurt the participants. This particular constituent has as I understand it, a historic farm equipment event that includes draft horses. And so there are implications, but it's like, I think, a one-time event, and our staff can talk about that particular event. But generally, we would not want to exempt all historical reenactment from this kind of oversight.
Representative Liebling.
Thank you, Mr. Chair. I mean, Mr. Pollack, could you just explain, what does it mean to be under the general subdivision 9 here? What happened? Because all we have is the amendment. We don't have the whole statute in front of us. So, special event recreational camping area means a recreational camping area that operates no more than 2 times annually for no more than 14 consecutive days. And then the amendment is what it doesn't include. So what does it mean to be, what are they being exempted from here? That's the question.
The current law that you're seeing there, Mr. Chair, Representative Liebling, the current law is a current law exemption for limited duration special events. What the constituent in the Senate, and I think the Representative Pearson is trying to address as well, is creating an additional exemption for a certain kind of historical reenactment which would otherwise be regulated as a campground.
So, Mr. Pollack, from what I understand about this, the bad thing that happens is that they're regulated in a way that doesn't reflect what they're doing. Is that correct?
Yes, Mr. Chair.
Representative Loeffler.
Well, thank you, Mr. Chair. Well, the discussion is about historical reenactment, which I assume means latrines or less. I'm concerned about line 1.11, which says, or is of educational value, because every camp advertisement I've ever seen says it's of educational value. And I don't think the intent was to eliminate all educational camps, but language has consequences.
All right. Further discussion?
Mr. Chairman.
Representative Hamilton.
Well, Mr. Chairman, I believe Representative Erdahl participates in Civil War reenactments, so I think this would be a pretty good bill, actually.
All right. Despite that, all those in favor, please say aye. Those opposed, no. E7 is adopted. Next up, the A9-2, and this is Representative Zerwas moves the A9-2. Representative Zerwas, to your amendment.
Thank you, Mr. Chair and members. This is a quick fix to the right to try bill that we worked on last year. I was just made aware of an issue that has happened since the right to try bill was passed, where inadvertently some language within last year's bill was used inadvertently by the state to deny some medications because there's an exemption on some experimental drugs. That was then overturned in court. There was 2 examples of this. One was prior to the right to try law, and one now has been post that, where they've both been originally denied and then overturned. So I've been working with the department, and we think this amendment is language to continue to treat folks with a Dravet syndrome with the drugs that they need, and not be bound by the language in the right to try law.
All right. Discussion. Representative Liebling.
Thank you, Mr. Chair. I just wonder if there's, since we didn't hear this, and that's what I'm understanding, it didn't get heard, and Representative Zerwas, I remember your right to try bill, which I was very much supportive of, but I don't know enough about what this is doing, and I just wonder if there's anybody in the audience who can speak to this. For example, somebody from the Board of Pharmacy, or if we have...
Mr. Chair.
Representative Zerwas.
I think Ann Henry is here, who's been handling some of the cases, and can give more of the background, and do probably a little bit better explaining how last year's language kind of ran us into the weeds a little bit.
Welcome to the committee. Please introduce yourself and proceed.
Thank you, Mr. Chair and members. My name is Ann Henry. I'm with the Disability Law Center at Legal Aid. On one point, the 2 cases are on behalf of children who are eligible for medical assistance, and there is a federal requirement that some of you are familiar with for early periodic screening, diagnosis, and treatment, EPSDT. And what happened is the department actually settled both of these cases because of the need and the medical necessity of this drug for children who had uncontrolled seizures. It is a standard of care for the pediatric neurologists that were treating these kids at the Mayo Clinic. The reason that the drug is disallowed by last year's right to try law is because it's considered investigational. The department, our office and the department disagree about how to define investigational, but the department is relying on FDA approval only. And this drug is never going to probably have approval because it only is needed by a few kids. So it's an orphan drug, and the pharmaceutical manufacturer is not going to get enough money to go through the FDA approval process. And so it's a sad reality, but these couple of children were delayed and had extensive hospitalizations in the ICU even, and at least the initial child, the one who has been on this for now, well, over a year, hasn't had any seizures since. So it's covered by, we think, at least 8 to 10 other states' Medicaid programs under EPSDT. And so it's one of those unfortunate problems that we really need criteria for, but we didn't have time to work enough with the department to get criteria. So they said they would just go this route with this drug because there probably are some other kids on MA, we don't know how many, a handful maybe, that need it. And they felt they couldn't because of last year's language, authorize it until the lawsuits were settled. So rather than go that route again and again, we wanted to bring this forward. Thank you.
Thank you, Ms. Henry. Ms. Drake, would you like to testify? Welcome to the committee. Please introduce yourself and proceed.
Thank you, Mr. Chair. My name is Sarah Drake from the Department of Human Services, where I manage the pharmacy program. We worked with the author with the bill last year, and the language that was in the bill last year was a codification of current practice. With the exception of 2 settlements for this one particular drug, DHS has never paid for any prescription medications that are not approved by the FDA. In order for a drug to be approved by the FDA, it needs to pass the safety and effectiveness bar by the FDA. This particular drug has not yet made it through that process. My understanding, I called the manufacturer of the drug, is that they have submitted it to the FDA, but they weren't able to provide me with any additional information on how much longer it might be or where it is in the process.
Thank you, Ms. Drake. Representative Liebling.
Thank you, Mr. Chair. So is there a fiscal impact? I mean, I'm imagining maybe there's a fiscal impact for the drug, but maybe there's also a fiscal impact for keeping a child out of expensive care by using the drug. Can anybody speak to that, please?
Mr. Chair, Representative Liebling, we are looking at that right now. We're pulling some data to determine the number of children who have a diagnosis of Dravet syndrome and trying to estimate how many might need this drug. We're estimating it's probably between 10 and 20 children who might request this particular drug. We're also looking at the efficacy data that is available, even though it hasn't been FDA approved, to try to determine if there might be a corresponding reduction in hospitalizations for the individuals who use this drug. As with any drug, it doesn't work for everybody, so we can't assume that everybody would have a reduction in hospitalizations.
Yeah,
Representative Liebling.
Mr. Chair, yeah, so this is sort of a conundrum that we find ourselves in a lot of times, and the problem with not having complete data on drugs, and sometimes even when we have it, we don't always have sort of the, forget what the term is now, but the relative effectiveness of, using a new medication versus an old one. And so I'm not really sure, is the department, I see that Ms. Zimmerman is there. I just want to know, do you support this? I mean, given that, this is sort of a difficult decision for us to make. It's sort of always difficult when we have to make these kind of decisions in the legislature, which is more a political process than a scientific one. And can you give us advice whether you support this or not at this point?
Welcome back to the committee, Ms. Zimmerman. Please introduce yourself.
Thank you, Mr. Chair. Marie Zimmerman. I'm the Medicaid Director at the Department of Human Services. Representative Liebling, we don't have a position on this particular bill. I think we were trying to work with Ms. Henry and the author to come up with, a good solution. What we've seen other states do is either one, put specific drugs and diagnoses to cover investigational drugs in law, or they have a process by which they're reviewing investigational drugs and how they approve them. And right now, we don't have either one of those things, so I think in the short term, without more conversation about this, we thought that was the best route to go.
Representative Liebling.
Thank you, Mr. Chair. You thought which was the best route to go? I'm not really clear what you meant.
Mr. Chair, Representative Liebling, the amendment that you see before you, but putting the specific diagnosis and drug to be covered in state law.
Okay, thank you. And Mr. Chair, if I could just follow up with that. So I think then, with that, I would support the amendment, but it kind of says to me, Representative Zerwas, it sounds like we need to do more work to have a process for this so that we don't have to come back, and I hope we can work on that in the future, because that's, that would be probably ideal, so that the legislature doesn't have to, so we don't have to be pharmacists too.
Mr. Chair.
Representative Zerwas.
Yeah, and I completely agree, Representative Liebling. From the information I have from the Disability Law Center, that this was an issue, even though the EPSDT is spelled out in federal law, this was an issue prior to that last bill being passed into law with the investigational drug use. At that time, the state was sued and the state settled. And despite that turnout, now in the second case, the state still decided not to look at the federal guidance on the EPSDT, and this time they pointed to the law, and at that time they were sued again and settled again. So now hopefully this will be super crystal clear.
All right, seeing no further discussion, all those in favor of adoption of the A9-2 Zerwas amendment, please say aye. Aye. Those opposed, no. The A9-2 is adopted. The next amendment we have up is the Gruenhagen A10 amendment. Representative Gruenhagen, to your amendment.
Oh, thank you, Mr. Chair. This one has passed in other sessions. There was no fiscal note with it. And basically what it does, there's a crisis in the rural area in terms of access of Medicaid or medical assistant patients to dental care. My sister works for a dentist. He purchased his dental practice from a retiring dentist. He was accepting about 4 to 5% of patients on medical assistance for dental care. However, they were refusing additional calls. Someone reported him, and now he accepts none at all. And in McLeod County, there's only one dentist in the county that I'm aware of that accepts medical assistance dental patients. I know we all agree we have low reimbursement rates, which contribute to this problem, but people are having to drive 100 miles, 75 miles to find a medical assistance provider. I have a friend, actually he's a supporter, who did not have dental care and could not get in to see a dentist under his medical assistance. He got an infection in his teeth. It went up towards his brain, and he wound up in the emergency room. This happened to him 2 or 3 times. I finally worked with him and found a dentist that would give him charity care, and was able to fix his situation. So this access for lower income people is a burden, and in talking to dentists, the 10% requirement is simply unaffordable for them. They put their own practice in jeopardy in the rural district if they accept that percentage of their patients on medical assistance. Not that they don't want to help. And some of these medical assistant patients are in nursing homes. My sister's dentist was treating a few of them. Now he can't treat any because of this 10% requirement. So what this does, it lifts the 10% requirement outside of the 7-county metro area. It leaves in place the requirement in the 7-county metro area, which my understanding, people have a little better access. And so that dentists who want to help somewhat on medical assistance dental patients can. Last session, there was 0 fiscal note on this requirement, and I would urge the committee to adopt this amendment.
Thank you, Representative Gruenhagen. I appreciate you bringing this forward again. I know how frustrating it is for members, particularly in greater Minnesota, to try to get rural access to dental care, and I was disappointed that this didn't make it through last time, so I would encourage members to support it. Representative Liebling.
Well, Mr. Chair, I just want to remind members, first of all, I think it's really troubling to treat dentists differently depending on where they're located. And, you know, it may be true that there's better access in some parts of the 7-county metropolitan area, and I bet that, you know, but I don't think it's monolithic, the 7-county metro area, and I just think that this is a, you know, if it's a good thing, which I'm not sure it is, frankly, and we've had that discussion before, but if it's a good thing, it's just pitting rural areas against the 7-county metro, and I don't know why we do that, honestly. But just to remind members, we've had this discussion at length before, and there isn't any good data about whether doing something like this actually increases access or decreases it. The rule is in place as a way to increase access. That's why we have this rule. And I don't know if DHS wants to speak to it again, but I recall pretty clearly that last time they did, they said, you know, we don't think that this actually helps. So, and if I'm misstating that, if somebody from DHS wants to come down and give their position, okay, here comes Ms. Zimmerman again, so, or somebody, I won't have to speak for them, but, you know, so if you're going to speak to your position on this, that would be great. And if you could also discuss the difference, you know, if there's the rural metro split here, if that makes any sense in terms of what we know about the operation of this. Because I think we all want to increase dental access. There's no question about that. And some of us even support the Medicaid expansion, which your constituent probably benefited from. He probably wouldn't even have, I venture to guess, if he's you know, an adult male, maybe he wouldn't even have Medicaid access were it not for the Obamacare Medicaid expansion. But anyway, please answer the question.
Ms. Drake, welcome back. Thank you.
Chairman Dean, Representative Liebling, we are not sure what the impact of this bill would be. It's possible that additional dentists in rural areas might be willing to accept more patients if the threshold were lower. It's also possible that the dentists that are seeing existing patients wouldn't see as many as they are seeing now. And that's the part we really don't have a good way to estimate or determine what the net effect of this legislation would be. And Representative Liebling, I think you also had a question about the urban versus rural split. That's something we could get for you. I don't have an answer right now.
Okay, so
Representative Liebling.
So, Mr. Chair, I don't know how much time we want to spend on this, but it's pretty clear that it's pretty unclear. And so if members want to just take a chance and, you know, well, there are other things that we are doing this year that we've been doing over the years to try to improve dental access. I know Representative Zerwas has been all over this issue and, you know, supported by many of us. There's other stuff in this bill, but, you know, I certainly don't want to jeopardize anybody's care. And I think this may very well go the other way and jeopardize people's care. So I would ask for a roll call on this vote, on this, and I would ask members to vote no, and I don't know if we'll have a urban-rural or whatever split, but I think it just puts something in jeopardy when the people who know are telling us they don't know what the effect of it will be.
A roll call having been requested, there will be a roll call on the A10-1 amendment.
Mr. Chair, can I just respond? Oh, go ahead.
And I think, you know, within regards to the urban-rural split, I can just tell you from my own personal experience from my district, Representative Liebling, I'm within the metropolitan area, and my constituents don't have access to a dentist in my district because they don't see Medicaid at all. They have to travel, you know, to Maplewood, I believe, is the first clinic that I'm aware of that, you know, I've talked to dentists in my district. So this doesn't affect them because they don't see the patients. So, I mean, I think what they would tell you is that they see charity care and they donate Friday mornings or whatever, that's what they do and that's how they're dealing with this. But for Greater Minnesota, I speak specifically with Senator Rosen, who has really spent many, many years on this and is really struggling with this, from a suburban guy to folks in Greater Minnesota. I think we need to do what we can, and this obviously is not working to improve access in Greater Minnesota, which is the area of greatest need, so that's why I would support the Grunhagen amendment. Representative Grunhagen.
Oh, thank you, Mr. Chair. Thanks for those comments, Representative Liebling. The number one, why did I go outside the 7-county metro area? Because it was a compromise with input I had about the 7-county metro area versus outstate Minnesota. Also, the bill in the past has had bipartisan co-authors on it. Rural DFLers have signed on to this, and they say it's a crisis in their area. In addition to that, as far as the results, we don't know. Well, I do know some of the results, because all you have to do is talk to the dentist, and the Dental Association in the past has supported this. They are not accepting patients because of the 10% requirement. Now, there is one dental provider in McLeod County that takes more than 10%. He's an older dentist who has his business paid for, and he can still, even though he has a great heart, I sat by him at a chamber luncheon in Winstead, and he would like to take more, but he is just overwhelmed with the request in his area or surrounding area by the amount of he can't see them all. And so he wants to keep doing his part, but he said, I have to have some alleviation from the people who are calling on a daily basis who cannot find access. And my sister, again, has worked for the dentist there for probably close to 15 years, and they get calls on a regular basis. And again, they used to accept some. Now they accept none. And so I do think the 10% is having a negative effect, although well-intended, and I believe this amendment would go a long ways to seeing local dentists treat medical assistant patients not only in the community, but also in nursing homes to get the care that they need versus a traveling dental van or whatever to try to meet that need. Thank you, Mr. Chair.
Thank you. Representative McDonald.
Yeah, thank you, Mr. Chair. I just speak in behalf and support of Representative Grunhagen's bill. After being here for 6 years, knowing this rule for the last several years anyway, or actually 6 years, I guess I said that. It does have an effect. There's a negative effect in the rural area in Wright County and in my city of Delano. I have had several dentists, Dr. Glavon and Dr. Madden, say that they would love to participate and help those folks who need the help, but they simply can't because of this rule. So the Lions Club and other organizations have stepped up in help in conjunction with the dentist who's participated and given their time, but there's only so much time and money that they can devote to this. So I supported this. We know that this would make a difference, and I would encourage you, Representative Liebling, to support this. It's a good rule, and it will certainly help those who need the help the most.
Representative Purcell.
Thank you, Mr. Chair. I didn't think I'd have an opportunity to plug my part of the state on this, but some of you must have been visited here when the Plaid was running around here, the Bemidji folks. I just want to offer up, there's alternatives to this too. And you may recall being visited about Northern Dental Access a number of years ago. We up in our part of the state certainly gained a better understanding of what dental care can mean for kids in school. Can they pay attention? Go down the list. And created Northern Dental Access, where it's actually a building where dentists come to volunteer their time. And this is, I mean, we don't have any trouble getting dentists to volunteer their time. None. None. And it's made, and I'd offer to you, I probably got as many or more folks that need this kind of dental care as anybody sitting at the table. So it's a big number for us up there, and we're dealing with it in a little bit different way. don't think this is going to affect what we're doing because there's so many dentists involved in it already. So I think in some areas, I'm just going to offer to you that I think dentists are going to have to look a little deeper into what they're doing. I guess we just do things different in northern Minnesota. Thank you.
Thank you, Representative Purcell. And Northern Dental Access is a very cool program. I know many of us have been actually through there, and you would be happy to take any member of the committee through if they're up your way. And I believe you have a project in the bonding bill as well this year. Representative Liebling.
Thank you, Mr. Chair. Well, you know, if you think that taking away Rule 101 is helpful, then why wouldn't you also do it in the 7-county metropolitan area? That's the thing, Representative Dean. I mean, there's considerable lack of solid data about whether this helps or hurts. We all want to improve access. But this bill, this amendment, says it's good for this. It's okay for the 7-county metro, but it's not okay for the rural areas. And so, Representative Dean, I don't know why you would support that. If you think that you need to remove that rule to help your district, then you should be either amending this amendment or voting it down because, well, maybe not. Maybe you think it's okay to just help the rural areas and not your own district. But, you know, if I thought that this was going to really help access in my district, I would certainly vote for it. But I'm listening to the experts, and they say we frankly just don't know. We're doing a lot of other things that are hopefully, we're all hoping are going to help with access, and this one we just don't know. So that's why I'm opposing this, and I just think it's tinkering around where we don't really know what we're doing.
Well, Representative Liebling, I'd just say that, I have talked to the dentist in my district. My dentist lives in my district. And, he pulls teeth at the Union Gospel Mission and goes and introduces, that's how he provides a lot of care and a lot of free care. He feels like that's the way he can do the most. I would need to look further at, is this going to help or hurt him if we did this? What he would probably tell you is that this is really, he was a former president of the Dental Association. He would tell you that, we got to do something in greater Minnesota. That's what this bill is going after, and that's why I would support this bill and would look to increasing access in the metro as well. But I can tell you right now that the blinking light on the dashboard is definitely in greater Minnesota on this. All right. Seeing no further discussion, roll call having been requested, there will be a roll.
Chair Dean.
Aye.
Vice Chair McDonald.
Aye.
Representative Liebling.
No.
Representative Loeffler.
No.
Representative Allen.
No.
Representative Backer.
Yes.
Representative Franson.
Yes.
Representative Gruenhagen.
Yes.
Representative Halverson.
No.
Representative Hamilton.
Yes.
Representative Lane.
No.
Representative Lohmer.
Aye.
Representative Mack.
Yes.
Representative Murphy.
Nope.
Representative Purcell.
No.
Representative Pearson.
Yes.
Representative Schoen.
No.
Representative Schumacher.
Aye.
Representative Zerwas.
Yes.
There being 11 ayes and 8 nays, the amendment 8-1 is adopted. The next amendment is Amendment A11. Representative Schumacher moves the A11 amendment. Representative Schumacher, to your amendment.
Thank you, Mr. Chair and members. The A11 amendment is in reference to the testifiers that we had near the end of committee yesterday, and I wanted to thank the members and especially the chair for their indulgence yesterday for the 12 to 15 minutes of testimony instead of the 2 minutes that was allotted to everyone else. I appreciate that, and typically I don't bring up just single facility type bills forward. There has to be something that's unique or pressing in particular for me to want to get involved in that way, because there are other efforts for the disability community and the waiver system for what they are doing for rates. And the reason I brought this one up is because this facility in Slayton, you heard about the topography of Slayton yesterday and a little bit about the population, but this facility on its own was started about 30 years ago, and it's literally a mom and pop shop. And about 2.5 years ago, mom got sick, was diagnosed with cancer, had 6 months to live. She was doing the bookwork for the company, and the bookwork kind of slid during those last 6 months. Then was left to Pop to take care of everything, and now he's sick and trying to recover from that, and he's out of the picture completely, except for financially. And so it's the son that's taken over the family business and learned about all the things that have been missed over the last 2.5 to 3 years. And they've been working with the department. The department's been very helpful to try and do some retroactive things to some of the rates that weren't collected the right way, but they're still looking at about a $700,000 loss this year because of some of the things that were missed in the past and some of the way they manage. A lot of their workers are single mothers who they don't want to remove health care coverage. They don't want to remove the benefits. They want to keep full benefits and full hours for these people, and that's been difficult for them. They've been trying to make decisions that would keep the facility open. Again, this is just a mom and pop. It's not a corporation. There's a third mortgage out on the homes for the family members now to take care of that. The second mortgage was to build the facility in the 70s. They're still paying on that, and a third mortgage just to do cash flow. And actually the pop in this situation is using his Social Security check to help with the cash flow of the business as well while he's trying to recover from his illness. So I think in that regard it's a little bit more of a unique situation. The people who are running for this, the people who ask for this, they just came upon this. It's kind of the family business that they ran into. And also the rates for this particular facility, the per diem rates for this one is about second or third from the lowest in the state. And so they're asking for a rate increase. Given the targets that we have this year and what was available, we did decide to take that from the central office of the department to take care of that. It is about a $403,000 ask for that with the Medicaid match. That would get them to their 700 so they could break even for the year, and that was what their objective was. And again, thank you for your indulgence yesterday and ask for your support.
Thank you, Representative Schumacher. Representative Hamilton.
Well, thank you, Mr. Chairman, and I just also like to offer up my support for this. I know Representative Schumacher has been working very closely with the family that's located down in southwestern part of the state where I represent as well, and so I just want to offer up my support. Thank you.
Representative Purcell.
Thank you, Mr. Chair. Just a quick question, if you would, Representative Schumacher. You said this is not a corporation. Is this set up then as a nonprofit?
Representative Schumacher.
Representative Purcell, no, it is. They are protected under a limited liability company, so it is for profit in the end. But the $700,000 loss is far from a profit for them.
All right, Representative Loeffler.
Well, thank you, Mr. Chair, and just trying to understand the circumstances. It sounds like there has been debt accumulated over a period of time, and that, if I understood it correctly, Representative Schumacher, this new rate increase would take care of that, but then it sounds like it would be a really enriched rate, perhaps higher than other similar facilities going forward. Am I misunderstanding that you've structured this in a way that would actually eliminate problems that have built up over years with a super enhanced rate, and then that continues and creates some inequities going forward, as opposed to a retroactive rate increase that just deals with the problem of the debt that you're describing, and then puts them on a fair ground with everyone else going forward. So I'm just trying to understand if this rate actually creates some inequities going forward, as opposed to a retroactive adjustment that would take care of the past issues from lack of bookkeeping, attention, whatever.
Representative Schumacher.
Thank you, Mr. Chair. Representative Loeffler, this actually goes to just their operating funds, not the debt that's currently on the business. This goes to what their operations are. And this would put them up higher going forward as well, but it also precludes them from utilizing the variable rate in the system, which they have been able to utilize up to this point, which has helped them along the way too. And so without the variable rate, they would have the fixed flat rate, which wouldn't give them that benefit. And so it essentially over time wouldn't put them at a greater advantage over others because of that.
Thank you.
Representative Schoen.
Thank you, Mr. Chair. That may have been a partial answer to the question. I don't see an expiration date on it, which would bring them back into line, say if you're going to give them this for 2 years, and then they're back in line with everybody else under the same, same playing field. That was what my curiosity was, but it looks like this is permanent. Is that correct?
Representative Schumacher.
Mr. Chair, Representative Schoen, this would be permanent. It would take them from being the second or third lowest in their per diem rates and bring them up just a little bit above average.
Okay.
And slightly above average, Mr. Chair, is what we really attest for, if that helps.
Representative Liebling.
Thank you, Mr. Chair. I thought his testimony was pretty compelling. I spoke to him a little bit afterwards, and the gentleman that was here, the brother of the pop, as you say, and, he's certainly trying to deal with a bad situation. I think we can all be sympathetic to that. One question I have, though, is that with the other amendment to the bill, with the author's amendment, I don't think that this actual amendment as written fits, or it's not accurate anyway. It needs to be rewritten. I don't know if staff just does that automatically. I think Mr. Berg is nodding his head. Okay, because the numbers that you're amending here in your amendment are no longer the numbers that are in the bill now with the other amendment. But, so I wonder I want to understand more where you're getting the money. You're not moving something that's within the bill already. You're taking more out of DHS administrative funds, or I wasn't really clear about that, Representative Schumacher.
Representative Schumacher.
Yeah, that, Mr. Chair, Representative Liebling, that's correct. That would come out of the administrative funds for that.
And then, Mr. Chair and Representative Schumacher, so then what happens as time goes on? Is that a one-time? Or maybe Mr. Berg can explain how this works, because, I don't want to have this one facility be, the barnacle on a certain fund going forward.
Mr. Berg.
Mr. Chair, Representative Liebling, it would, as Representative Schumacher indicates, pay for it in the current planning horizon by taking money from the DHS central office operations line. So that is on the spreadsheet. It would do it in fiscal 17, 18, and 19. But the expenditure is then a medical assistance expenditure, which would be absorbed into the forecast. It does, however, reduce the central office operations line. But the MA line would go up to cover it, but the central office operations line would not go back up.
All right. Representative Liebling.
Well, so Mr. Chair, I'd like to do something for these folks. We had earlier in the session, we had a very robust conversation on the floor about helping some folks who needed unemployment insurance, who were kind of in desperate straits. And, there was some discussion that, kind of traditionally when there have been sort of emergencies, we've all kind of tried to help, no matter which district they're in. I don't think that exactly happened so well this last round. But, obviously this is a long way from my district. That doesn't mean I'm unwilling to help them. I think, wherever a person with disabilities is living, we ought to, as Minnesotans, be willing to step up, make sure this, to the best we can, keep these kinds of operations afloat, mainly because the people they serve and the people who work in them. So I think it's very valid, but I am really concerned about what I just heard and where the money's coming from, Representative Schumacher, and I wonder if, if this goes on the bill, can you figure out before, work on this before it gets to the floor to maybe figure out a more fair way to do that, because, man, if that's, if that's okay to do, to fund something like this, I don't know, I think that's really problematic. If we're opening that can of worms, we may find that that's, problematic for us.
Mr. Chair, Representative Liebling, if the committee is so gracious as to put this on the bill, I would be very happy to work to make sure that there aren't unintended consequences or long-term consequences because of that.
I tend to agree with Representative Liebling. I think that it would probably be a very difficult thing to maintain on the floor without numerous amendments for, I'm sure we all have, struggling facilities in our own districts, and well, my heart goes out to that family in particular. We'd look for ways to try to provide them some relief of some kind, but I'm a little concerned about moving forward with that line item, because I think it would just immediately open the opportunity for each and every district to have a similar situation. So I appreciate you stepping up for the people in your district, and I would do exactly the same thing if I lived in your district, Representative Schumacher. But I think that the precedent would be difficult to maintain, both in the spreadsheet, but also as we move forward to the floor. Further discussion? Seeing no further discussion, all those in favor of the A11 amendment, please say aye.
Aye.
Those opposed, no?
No.
No. The A11 amendment is not adopted. All right. The A12 amendment is withdrawn. The A13 amendment is Representative Zerwas. Representative Zerwas to the A13 amendment.
Mr. Chair and members, the A13 amendment came through committee and is currently on the general register. It sets up child advocacy. So last year, we appropriated $400,000 by the legislature last session to develop and expand children's advocacy centers in some of the areas in the state where this is a new idea or a new concept. There were concerns that child advocacy centers specifically weren't listed as a part of a team investigating these types of horrific incidents, along with the county attorney's office, social workers, and investigators. And so this amendment would take that bill and put it onto yours. And the subdivision 4 has the definition of child advocacy centers, and then line 2.1 on the amendment adds the child advocacy centers as a part of the care team.
All right. Questions to Representative Zerwas, A13 amendment? Seeing no questions, all those in favor of adoption of the A13 amendment, please say aye.
Aye.
Those opposed, no. The A13 is adopted. Next up, we have Representative Schumacher, A15 amendment. Representative Schumacher moves the A15 amendment. Representative Schumacher, to your amendment.
No, Mr. Chair, I withdraw the A15 and the A17 amendments.
The A15 amendment is withdrawn, as is the A17 amendment. Representative Zerwas moves the A20 amendment. Representative Zerwas to the A20 amendment.
Mr. Chair and members, this is House File 2380. It is a Chair David's bill. I think probably from his capacity on the Legislative Oversight Committee of Mincher, and it is reducing the withhold that Mincher currently places on every insurance policy sold on the insurance marketplace. The bill is an attempt to make sure Mincher deliver on the promises that it was first set up upon. It's really a simple concept. Our constituents shouldn't have to pay full price for what has time and time again been proven to be a completely broken and unworkable product. So we cut the Mincher tax in half in 2017, then set a series of basic operational benchmarks in order to buy that withhold back. As we saw with the call center crisis at the end of last year, the Minnesota Care renewal debacle, which I'm still getting questions and calls from constituents on the ongoing and continuing here on April 15th, 1095A catastrophe, in which we still have constituents waiting for information in order to file their income tax. There's really no reason. There's really no reason that someone in Minnesota today should pay full price for MNsure when it's failed at every benchmark and every operational level in every measurable way to date. And so that's the amendment, Mr. Chair.
Thank you, Representative Zerwas. And I would just remind members that this was not heard in our committee. This was heard in the Commerce Committee and Taxes, and it is currently in Ways and Means. So we did not hear this. We did not need to hear this, but it's here to go in our omnibus bill as the path to carry this forward. Representative Loeffler.
Well, thank you, Mr. Chair. Where it didn't go was the Health and Human Services Policy Reform Bill, and it has some major policy implications that were not discussed, as I understand it, in those other hearings. And in addition to the financial implications that I think are a whole different set of topics. But if you look under line 2.11.2, I mean, I don't have any problem with holding MNsure accountable to meeting reasonable benchmarks. But 2.11, you know, the subpoint 2 is that MNsure automatically processed enrollment renewals and in public health care programs. We have obligations to the federal government and to our taxpayers to make sure that we meet, that renewals meet eligibility criteria. We've heard from the OLA, had a big discussion on the topic of the need to make sure that everybody who's renewed is eligible, and I don't think automatic processing in public health programs so automatic renewal is going to assure compliance with our federal and state laws. It also, under Clause 4 on line 2.15, provides for self-service functionality for changes in qualifying life events, removing or adding household members, changes address, incomes, etc. Of course, all of those things impact whether or not someone is eligible for a public program. And we have never before put the control in the hands of the consumer in an automated way to make changes and continue on in a program without the verification of either county or DHS staff. And so Chair Davids, in presenting this at the Tax Committee, acknowledged that he doesn't understand the public health programs and doesn't really want to come join us, even though I always invite him. And I think this has some real problems in terms of its implications and our ability to comply with the expectations in state and federal law.
Thank you. Representative Liebling.
Well, thank you, Mr. Chair. And so I just, to maybe say it a different way, this appears to really open the door wide for fraud.
Yeah.
And for real problems with verification. So, you know, if you all want to vote for it, I think we should have a roll call on it, because it really moves in the opposite direction of where we've been trying to move in terms of tightening things up. I also want to say, while I have the floor, that, you know, every time certain members speak about MNsure, you know, there's this unbelievably rhetoric about what a great disaster and blah, 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 blah. And I think that's unfortunate, because there are some things that happen that really are disasters. And when you use up the language on something like this, which, you know, we've all said, we know that the rollout was, you know, really not done well, and a lot of people had problems and so on, but it isn't an unmitigated disaster. That's just not true. There are plenty of people who are actually doing just fine using MNsure. It gets better all the time. It still has problems, sure it does, and there's no problem acknowledging those problems, but boy, I don't know how many years are going to go by that we're still going to be using this same language that never changes when the actual facts do change. So, you know, with that comment, I would like us to have a roll call on this amendment, Mr. Chair.
Representative Liebling, could you, if you wouldn't mind, just describing, and like I said, I have not heard this amendment because I don't sit on either the taxes or the Commerce Committee. So could you talk about, and you said that this would provide a greater opportunity for fraud in specific, and I don't know if you sit on those two committees or if that was discussion within those committees. But can you talk about some of the discussion points around that, because I really don't know.
Well, Mr. Chair, I was kind of going off of what Representative Loeffler was talking about. I don't serve on those. It was Tax and Commerce, I believe, and I don't serve on either of those either. But just looking at the language here, what MNsure is, the changes that they're really asking MNsure to make without, you know, I mean, maybe there's, it's kind of like maybe they don't, maybe it isn't really meant the way it's stated, but when you're talking about, you know, MNsure should provide self-service functionality for account changes and changes necessitated by life events, adding and removing household members, making changes to address or income, canceling coverage, that's probably fine, and accessing online proof of coverage forms. I mean, when you're having people do self-service around, you know, adding and removing household members, qualifying events, you know, when you've got automatic, on line 2.11, MNsure is supposed to do automatically processed enrollment renewals. You know, we're talking about, you know, I don't know if it's intended to be baked into this, that all the checks and balances around that would be fulfilled, but it seems to me that this is trying to push things a little too far, too fast. This is a kind of bill that definitely needs a full hearing in this committee, and really shouldn't be put on this bill without that kind of vetting.
Yeah. And Representative Liebling, I kind of understand where you're coming from on that. The when you look at fraud detection and verification and eligibility control, that's something that you know, that Representative Drazkowski gets at, that I'm going to be offering that as an amendment coming up here shortly. But when I talk to the people who work for the counties and the caseworkers, and they say that under the old system, if there's a mom with 3 kids, and I used to be able to just change the address once, and it would change for everybody's, and now I have to go through and enter that 4 times, and then if I make one mistake, 1 dot and 1 line in one area, then the whole thing gets screwed up. And it just kind of seems to me like this is responding to some of those very basic complaints about the functionality of a $300 million system that should have been working a long time ago to do really dumb things like update files instantaneously. We shouldn't have to ask them to do this after spending that much money. But I think that that's what, as I read Representative David's bill, that's kind of what comes to me as those discussions that I've had with all of those folks complaining about how this thing doesn't work.
Well, Mr. Chair, you know, you know, we all agree that we should have better functionality, and I think we've really actually heard that we are moving in that direction, and we know there are still some problems. I think, though, that there's just a problem with taking this approach, and as I say, you know, it may turn out that underneath some of what is being asked for here, you know, would be some more detail that we would be looking for. But I mean, I just think this just shouldn't be an amendment. This is a bill. It should be fully vetted as a bill. It should have come here, or it should have gone to the Reform Committee as a bill. And it's really unfortunate that it didn't, because this definitely would impact all of these issues that we are always talking about in this committee. But, you know, I mean, I'm still going to encourage members to vote no on this, but I'll withdraw the roll call on it. But I just think that you're potentially adding trouble to your bill if you put this in, because it, you know, it hasn't been heard here. It doesn't really need to be on this bill. It is traveling by itself and should be better vetted before it goes to the floor.
Representative Halverson. No. Representative Mack.
Thank you, Mr. Chair. And just a brief comment. As I see it with this language, particularly the part about the self-service functionality, I have spent some time over the past couple years listening to the tapes from 2013 of what Representative Atkins and other proponents of MNsure at the time described what MNsure would be for the state of Minnesota and the promises that were made, just to try to tease out what promises were made and where are we at in terms of delivering them. And it was a claim that was made very boldly multiple times that the ultimate goal, one of the ultimate goals of MNsure was a self-service functionality. The counties are operating under the assumption, and have been since 2013, that at some point, you know, the need for the high rigor of work and paperwork that caseworkers had to do would be significantly reduced due to self-service functionality. At every MNsure Legislative Oversight Committee, on the task list that minute shows us, self-service functionality used to be on that calendar of something that was going to be a deliverable. It has ceased to be there for this current year because they know it's a ways out before that's possible. So the way I see it, this bill, there's not a whole lot in here that's brand new, that hasn't been purported by MNsure, proponents of MNsure, or the author of MNsure back in 2013. This bill is trying to put some accountability into the deliverables of what was promised 3 years ago. And so these were things that were talked to. These are things that counties have assumed are a possibility down the road. And so I don't see this as brand new possibilities. If you supported MNsure 3 years ago, these were promises that were made at that time. And now we're just trying to say there should be some accountability as to whether or not this is happening. Thank you, Mr. Chair.
Representative Loeffler.
Well, thank you, Mr. Chair. And I think self-service functionality for changing your address, unless you change out of a county, doesn't seem like a big deal. Self-service functionality for a change in a life event, adding and providing proofs of that you're eligible. If you've changed jobs and you have to report the changed income. You have to provide pay stubs, you know, all those sorts of things. The automatically processed enrollment renewals, after all the time we spend discussing with the OLA audit, says that we continue to rely and want to rely on our county and state system to make sure that people do reestablish their eligibility with the kinds of documents and proofs. And you've actually, in assembling this bill, actually added new proofs that are going to have to be assessed, including assets, which means in the past, county workers have had to look up car values on you know, Blue Book type publications. They've had to look up or get appraisals on other types of assets. That's not something that I don't think that you can do automatically. And I don't know that we want to have automatic renewals as a benchmark for the system until we understand whether or not it can comply with the federal law that people prove they are eligible. They prove that they have the income, and if their income changes, that they report it, that it's reviewed. If they've gotten a layoff notice or their hours have been cut, they provide proof of that. I mean, we have a system that isn't based entirely on trust. It is based on proving things to the system and having the paper documentation so that when the federal auditors come out, there is the paper documentation that we did not just trust everybody, but that we verified.
All right. Representative Zerwas.
Just final thought, Mr. Chair, I guess. I'm astounded at a few things. The degree to which some believe MNsure is operating really, really well. That is astounding to me. And the fact that some individuals want to block out the sales pitch. The sales pitch that we were told. I mean, we were told it was going to be the Expedia, the Travelocity of buying health insurance. You'd go online, you'd click around, you'd compare everything, you'd buy, it'd be great. Over $300 million, and the system doesn't work. Whether it's change of life events, whether it's the 1095A forms, whether it's the Minnesota Care re-enrollment, which I don't know if it's just my legislative district, but through the help of staff, 17 different constituents of mine worked through my office in order to ferret out that confusion from December to January, which stretched into March. I had a single mother who I happened to graduate from high school with who called me in tears because her 4-year-old had to get an antibiotic, and she was kicked off of her insurance, and she got called and told to put on hold on this number, and then told to call this number, and nope, not the county, go back to DHS. And she couldn't afford the antibiotics for her daughter. And so it's really stunning to the level and degree that people will look past that. And so what this amendment says is we had a huge list of promises. And if you look at the entire list of promises, you can see not delivered, failed, underperformed, consistently. Where's that extra money in everyone's pocket that Representative Atkins promised? It's not there. It's not there. And so what the amendment says is on this withhold, why are we paying full price for a product that they haven't delivered on at all? That's the amendment, Mr. Chair.
All right. Seeing no further discussion to the A21 amendment, all those, or excuse me, the A20 amendment. Oh, roll call was withdrawn? Withdrawn. All right. Seeing no further discussion to the A20 amendment, all those in favor of adoption of the A20 amendment, please say aye. Aye. And those opposed, no? No. The A20 amendment is adopted. All right. So here's just kind of a status update for where we are. We have approximately 15 amendments more. So what I would like to do is take about a 45-minute break. So we will come back here at 2 o'clock. Thought we could try to get it through in one stretch, but unfortunately we're not going to be able to do that, and we will finish the 15 remaining amendments. There's food trucks parked out in front, so I think we run out there, you might be able to catch one, and hopefully it's still nice out. So we will be back at 2 o'clock. Recess.